Yes. Please don't laugh at me. Hi, Marnie. My name is Jill, and I'm a nurse practitioner student, and I'm going to be performing a head-to-toe assessment on you today. Can you go ahead and tell me your full name and your age?
My name is Marnie Brown, and I'm 18 years old.
Okay, great. And so just let me know if anything makes you uncomfortable or if you want to stop. I'm just going to be, the head-to-toe assessment involves looking at you, kind of inspecting your body and maybe touching you a little bit here and there, but please let me know if you want me to stop at any time, okay? All right. So Marnie is a very pleasant and well-groomed young lady. You can't see me in the video. All right. She appears well-nourished and has great posture. She's dressed appropriately for the weather and so far is responding appropriately to my questions. So Marnie, I'm just going to start out the assessment by looking at your skin, and then we'll move to your hair and your scalp. So I'm just going to move your hair out of the way a little bit here. Your skin looks great. Maybe just some mild acne currently, and maybe just a little bit of mild acne scarring. But I'm going to just feel your hair, which is nice and evenly distributed. I'm not seeing any lumps, bumps, or lesions anywhere. Hair is clean and well groomed. Okay. All right, good. And then I'm just gonna, can you smile for me? Good, and clench your teeth. Good, and then stick out your tongue. Good. Everything looks very symmetrical. I'm not noticing any involuntary facial movements. So I'm just gonna move on to your eyes. Look at your eyebrows. They look clean, no crusting. Your eyes are free from any exudate and look healthy. I'm just going to pull down your eyelids a little bit here. Sclera is nice and white. Conjunctiva are pink. Great. And then I'm just going to look straight ahead at the wall for me. Good. Pupils are equal. And then look at the tip of the pen here and just follow it all the way and don't take your eyes off of it. Good. Pupils accommodate and are equal. Excellent. And okay, and then just keep looking at the tip of my pen. Don't take your eyes off it. I'm going to move it away from you, so just only move your eyes, not your head. Excellent. Okay, I'm going to have you look at an eye chart here, and cover one eye for me. And ideally this would be about 20 feet away on the wall. If you could just read this second to the top line for me.
874.
Okay, and then switch eyes and read this line here for me.
2843.
Okay, great. Thank you. Okay, I'm going to take a look at your nose next. Actually, let me palpate your sinuses. Let me know if you feel any pressure or pain as I'm doing that, pressing here and here. Any pain or pressure?
Nope.
Okay, good. Just going to look at your ears. Any pain when I'm doing that? No. Good. Okay, now let me just look at your nose. Just going to press one side. Can you breathe for me? Good. Other side. Good. Is that pretty easy for you? Great. Okay, I'm going to have you open your mouth wide. I'm just going to take a look around there for a minute and stick your tongue out and say ah. Good. Symmetrical movement of the uvula. And now I'm going to palpate your lymph nodes here. Preauricular, postauricular, occipital, I'm not noting any lumps, bumps, anything like that. Good. All right, and then as I'm pressing on your shoulders, can you lift up for me? Good, and then back down. Good, and then just take your arms out to the side and move them up over your head and down. Excellent. And then I'm just going to look at your skin. Check your capillary refill. Okay, that's nice and brisk, less than 3 seconds. Good, and then I'm going to check your pulse, radial pulse. 2+ on the left. 2+ on the right. Okay, good. And then if you could turn around so your back is facing the camera. Thank you. And then I'm just going to lift your shirt up a little bit here. Get rid of my pen light. Lift your shirt up here a little bit. Can you hold it up for me? Okay. And then just sit up tall, take a nice deep breath in for me. Good. And then I'm just going to take a listen and put your shirt back down. And just take some nice deep breaths as I go. Good, all lung fields sound clear. All right, now I'm going to put my hands on your back, and as I go down, say 99. Go ahead.
99, 99, 99, 99.
Okay, good. And then I'm just going to tap on your back a little bit here. And then just a little harder tap down in this area. Let me know if you have any pain with this. Did that hurt?
No.
How about on that side? Any pain?
No.
Okay, good. If you could turn around for me. Great. And then I think I'm going to have you lay down on your back now, and actually let me listen to your lungs on the front first here. Some nice deep breaths. Okay. Okay, good. Sounds clear. I'm going to listen to your heart now. This is the second intercostal space. I'm hearing S1 and S2. Okay, good. S1 and S2, no murmurs, no rubs, no gallops, anything like that. Okay, I'm going to have you lay down on your back now. And then I'm going to listen to your bowel sounds. Good. I'm just gonna tap on your belly just a little bit here. Any pain or tenderness?
No.
Okay, good. And then before I have you sit up, I'm just gonna check your reflexes, because this isn't tall enough for me to have your legs hang freely. I don't wanna move that. Okay, so I'm just gonna tap your knee here with my stethoscope. Good. Good, nice reflex there, and then I'm gonna tap the back of your ankle here too. Okay, great. You can go ahead and sit up for me now. Can I give you a hand? Great. Okay, and then just gonna look at your legs here. Good. Oh, you know what I forgot to have you do? Sorry, can you lay back on your back and let's do the range of motion for your hips. Okay, good. I'm just gonna lift your leg up here. And we're gonna move it up. Bend your knee for me. There you go. And then I'm just gonna move it out and over. Any pain with that? Good. Nice full range of motion on that side, and same thing on this side. Go across the midline, adduct. Good. Okay, thanks. Now you can sit up again. Okay. All right, and then if you can pick up this leg and take your heel and run it down your shin there. Great. And same thing on the other side. Excellent. Okay, let me get a cotton ball. I'm going to have you close your eyes and then just tell me where you feel me touching you with the cotton ball.
Forehead. Knee. Thigh. Forearm. Chin.
Okay, great. All right, and then if you could stand up for me. And if you could, starting on that side over there, if you could just walk towards me normally. I'm just going to assess your gait. Okay, go ahead. Great. And then if you could turn around and go the other way and walk, placing one foot directly in front of the other, and just walk a few steps that way. Excellent, nice balance. Okay, and then if you could come back over here and stand right here on this spot and face that way, and put your feet together and close your eyes. I'm going to make sure you don't fall. I'm just checking your balance here. Excellent. Okay, great. You can go ahead and have a seat. And see, I'm sure I probably forgot something, but that's okay. All right, thank you so much.
Thank you.
It was great to meet you.
You too.